Hi, my name is Mama Amabanks, and today I'll be talking to you about macrovascular disease and diabetes mellitus. So these are our learning objectives, but before we're going to talk about how the importance of macrovascular disease, the types of macrovascular disease, how does diabetes and macrovascular disease relate, and then how does a person who's living with diabetes reduce their risk of macrovascular disease, and then we conclude. As a means of introduction, talking about diabetes, we know it's a condition, a lifelong condition whereby you have abnormal levels of blood glucose. And this blood glucose is as a result of insulin hormone, the hormone insulin producing either too little insulin or producing no insulin or producing some amount of insulin but which does not work properly. So this then gives us different categories of diabetes, type 1, type 2, gestational, and others. Today we'll be talking about the macrovascular complications or macrovascular diseases. There are microvascular disease, and as the name suggests, if you say macro, it means something big. Micro is something small. Macrovascular diseases that we are talking about are related to the heart and the big vessels. So the diseases are diseases related to the heart, the vasculature. So mostly you're talking about the heart, the brain, and then the peripheral arteries. And remember that the vessels go to every part of the body. Now, what is the relationship between diabetes and macrovascular diseases? Now, it's been found out that hyperglycemia, which is abnormally high levels of blood glucose, and insulin resistance, both of them contribute to macrovascular complications by causing atherosclerotic changes in the vasculature. Atherosclerosis is more of a plaque build-up in the vessels. So in the walls of the vessels, you have a plaque building up, and that can narrow and sometimes reduce the blood supply to that particular organ that it's supposed to go to. Or when it does that, it can give various problems. So depending on where the blood supply is going to. So it could be going to the brain, and that might result in a heart attack and a stroke. Going to the heart may result in a heart attack. And then in the peripheries, it causes peripheral artery disease or peripheral vascular disease. It's important because of the high mortality which is associated with it. It's been found out that in type 1 diabetes, up to 44% of people who die is as a result of cardiovascular disease or macrovascular disease. And for type 2, it's actually higher, up to more than 50% of people who die with type 2 diabetes, the cause is due to cardiovascular diseases. So it's important that we know this and be able, if a person is living with diabetes, be able to reduce the risk of this condition. So how do you reduce the risk? Well, the first thing is lifestyle changes, and it's the cheapest, but unfortunately it's also the most difficult for people to initiate. But once they start it, it's able to stick to it. So the first thing is talking about your diet. Now, the diet doesn't mean just cutting out everything, but it means eating the right thing at the right time. So for your diet, you're thinking about eating healthy. Healthy means cutting out high fructose, high carbohydrate diet, replacing it with things which are complex carbohydrates, which are difficult to break down, will not cause your blood sugar to rise very fast. So you want to replace these fast foods with high cholesterol with healthy meals, and also reduce the portion sizes. The second thing is to exercise. The WHO recommends that at least you exercise at least 30 minutes every day for 5 to 6 days a week. At least it could be aerobic and anaerobic exercise. With this, you're targeting weight loss, because it's realized that it's been documented that weight loss will actually also reduce insulin resistance, which is related to macrovascular complications. Smoking is related to peripheral artery disease, peripheral vascular diseases. Stopping smoking is going to reduce your risk of getting this. So there's no question about whether to reduce, is actually to stop smoking. Then we talk about alcohol. Alcohol is related also to can cause hypertension, high blood pressure, which is related to cardiovascular diseases. So the advice is also to reduce the amount of alcohol or cut down the alcohol. So lifestyle changes are actually what you begin to do if you are living with type 1 or type 2 diabetes to be able to reduce your risk of macrovascular diseases. So I created a little checklist to help us to decide what to do. So when you go to the hospital, what do? You check your blood pressure at each visit. So your blood pressure target should be 130/80 millimeters of mercury. So if at any point in time you check your blood pressure at home or at the hospital and it's more than this, it is recommended that you talk to your healthcare provider and measures be put in place to be able to reduce your blood pressure so that you'll be able to reduce your risk of macrovascular diseases. Blood glucose, you check your blood glucose, you do home monitoring at home. And it's important to make sure that your blood glucose lies within the normal limits. You don't want hypoglycemia. Hypoglycemia actually also increases your risk of macrovascular diseases. You don't want hyperglycemia, which is also going to increase your risk of macrovascular disease. You talk to your healthcare provider and you decide the target of your blood sugar so that it will not cause any untoward damage to you. So targeting HbA1c is also very important. You talk to your healthcare provider about which level you're gonna target and work at it by taking your medications and also by eating the right thing. Cholesterol, as lipids, also are important in both in macrovascular disease and also related to atherosclerosis. So you want to make sure that every year you have your blood cholesterol checked and you're looking at both the good cholesterol and the bad cholesterol. The bad cholesterol is what we call the LDL, bad cholesterol in quotes, LDL cholesterol. The good cholesterol is the HDL. So you want to increase your HDL and decrease your LDL cholesterol because high levels of LDL cholesterol is related to cardiovascular diseases and macrovascular diseases. So you're targeting an LDL less than 70 milligrams per deciliter and targeting an overall total cholesterol less than 200 milligrams per deciliter. Aspirin use, controversial. Some people give aspirin as a primary preventive measure of cardiovascular diseases. Apart from this, there are certain other examinations which I would recommend that you do. You talk to your healthcare provider about. So examination of your eye, your kidneys, your liver, and then your feet. For your feet, two things are involved. You're thinking about microvascular and then macrovascular. Microvascular being the peripheral neuropathy where you have the tingling sensation and other things, and macrovascular can actually lead to problems, can lead to gangrene of your foot, which you don't want, or ulcers which would not heal. So at the end of the day, you have to take very good care of yourself. You have to realize that you are the one who is going to talk to your healthcare provider and then be able to make sure that all these things which are on your checklist are actually performed and actually done. Make sure that at the end of the day, health is what comes first. Take good care of yourself so that you'll be able to live a long, productive life. Thank you.